So I know right now most of us are worried about COVID, but in Trinidad we are still getting waves of the Saharan dust that's affecting many of us, especially those asthmatics. So today I wanted to go through the proper use of the inhaler with you, because when used correctly, it can save you that trip to the hospital, as it's just as effective as a nebulizer. So let's get our pieces of equipment. So the first we need is our inhaler. So this blue inhaler is called Ventolin or salbutamol, and this is our rescue inhaler. So this is what you need when suddenly your chest feels tight or you can't breathe. Now if it's your first time using it, or the first time in a long time, remove the cap, shake it up and just spray 2 puffs away from you to prime it. Now the next very important piece of equipment is this. This is the spacer. Ideally everyone should use a spacer, but specifically children. There are 2 reasons for this. One is because it saves you the worry of that coordination between administering the medication and trying to breathe. And the other is that it helps get the medication exactly where it is needed, which is the lungs. Without it, a lot of times the medication actually stays in the mouth and the throat. So now this part is where you insert your inhaler, like that. This part here is the mouthpiece. So this is where you make a nice tight seal with your lips around here and try to prevent any air from leaking out. Now generally for kids over the age of 5, they're able to. Some of them do have some difficulties, and definitely the younger ones won't be able to. So then we have this, and this is called a face mask. So you attach the face mask to the mouthpiece, and this face mask will cover their nose and their mouth, like that. So when you are ready to give them the medication, try to have them as upright as possible. You shake up your inhaler and you insert it into the space. Now you want to shake it up because without shaking, you might administer more propellant than medication. When it's in and ready, you put it over their face, nice and firmly, and you administer 1 dose. You let them breathe normally for about 10 seconds or 10 breaths. When they're finished, you then remove the device from their face and remove the inhaler. You wait for about 30 seconds to a minute before administering the second dose. So you shake again, insert it, and repeat. Always administer 1 dose at a time into this chamber. Now, the other important bit of information to know is that you have different types of inhalers. So this particular one is your rescue inhaler, the blue inhaler that we spoke about. But there's also this, your brown inhaler, your preventer medication. This particular one is beclomethasone. If your doctor prescribes this, this is to be used every day as prescribed, not just when you have an attack, because this prevents you from getting an attack in the first place. The other important information is your care for your spacer. So please take very good care of it. Always inspect it to make sure there are no cracks, no tears in the face mask. To clean it, you wash it out in warm soapy water and rinse it out. You then let it air dry, because if you wipe it with a towel on the inside, it actually creates a static buildup. So when you administer the medication, it sticks to the surface and it won't actually get to the lungs. Now, you can do all of these things, but sometimes it won't help and you will have to take your child to the hospital. So please be mindful of that.